Well, now we are discussing the Nipah virus outbreak in India. Now, after the deadly Nipah virus claimed 2 lives in Kerala's Kozhikode, another 24-year-old health worker has tested positive for the virus, bringing the number of active cases to number 3. Now, Kerala Health Minister Veena George confirmed that the contact list currently stands at 706, out of which 77 are high-risk contacts. Now, 43 wards in 7 panchayats in Kozhikode have been declared containment zones. Now, experts say that the need of the hour is continuous and long-term surveillance is required. Now, the Kerala government has set up a control room in Kozhikode and advised people to use masks as a precautionary measure. Remember, Kerala has witnessed outbreaks of the Nipah virus in 2018, 2019 and 2021. The virus is zoonotic, which means that it can spread from animals to humans and is believed to come from the fruit bat.
3 samples are tested Nipah positive, and yesterday morning onwards we have started contact tracing and categorizing the contacts. So we have now 706 people in the contact list, and out of these 706 people, 77 are in high risk and 153 are health workers, and those who are in high risk category, they are requested to remain in their houses, and if they have any symptoms, they are asked to contact the call center or the control room, and the control room will direct them to the medical college. So ambulance facility is also arranged. So once a person from isolation who is in the high risk category, if he or she reports symptoms, then the health system will move to the person and the person will be transported to the medical college.
Doctor, in the state of Kerala, the Nipah virus has been confirmed for the 4th time. So the question in everyone's mind is there any reason, geographic or otherwise, why the state is repeatedly witnessing the Nipah virus outbreaks?
See, that is one of the major questions that everyone is asking. And interestingly, even after having all these 4 consecutive outbreaks in the state, there have been no long-term surveillance program to detect what could be the source of infection, what is the actual human spillover interface between the bat Nipah virus and the human infections. In the first outbreak itself, the index case was we could not trace what was the origin of infection to the index case, and subsequently from that first patient, it got transmitted to others and caused a significant more number of infections. Second case was only one case which did not fortunately got transmitted to other individuals, but there also the connection with the bat source or the any other source which is infected, that was not established. Third time also the same thing happened. But interestingly, in the recent outbreak, the ongoing outbreak, there are more issues. Essentially, in the old outbreak, it was an encephalitic form of disease. But in the present infection, it is primarily a respiratory form of the disease, and the clinicians says that there was no encephalitic presentation. It was primarily a pneumonia kind of a presentation. So that also maybe one of the reasons why the first case was missed. So unless we know the index case and its contacts, its travel history, or maybe the behavior of that individual, whether they are coming in contact with these bats or the sources that is contaminated with the bat saliva or excreta, it is extremely difficult to establish why this is happening in this particular location.
Well, yet another threat from the world of zoonotic viruses is looming over India. Now, after 2 lives have been lost, Kerala is being put on high alert. Well, that's all from my side. We'll continue to track more news and updates on this story as the day progresses. Thanks for watching.